last several decades in this country, there have been really great strides in improving breastfeeding rates, both of exclusivity and of duration. However, what we see really is that most of the gains have been made early on with initiation of breastfeeding, and that there are still significant drop-offs in the first 3 and particularly 6 months for duration in general and specifically for exclusivity, both of which we know are critical for the health of the baby and the mom. There are lots of things that we can do, we know from evidence-based, to improve these rates.
We saw that women were struggling to meet their goals. They were also having problems with they're worried about returning to work and being able to breastfeed at work. So we wanted to support our WIC staff in providing great breastfeeding counseling, and we also wanted to support our businesses into creating breastfeeding-friendly environments for these women.
A lot of our participants do have to go back to work pretty shortly after their baby is born. The policy that was put into place has been really helpful with employers being more open and more aware of needing to provide space and time for our breastfeeding participants.
Here in Virginia, we have a number of different initiatives to create breastfeeding-friendly environments. We have an initiative working with the hospitals, and so the next domain is really the workplace.
We had several employees who were out on family medical leave for the birth of a child, and that prompted the need for us to start looking at ways to accommodate these employees as they come back into the workforce. We worked with the health department in creating a comprehensive lactation program for all county employees.
A lot of moms don't have an adequate place to pump. They're having to pump in a break room, in a utility closet, or their car, or going to a bathroom. You know, a public space, which is not ideal for breastfeeding. Breastfeeding is a very personal, intimate experience, and if you have to do it in front of a group of people, let alone your coworkers, sometimes the barriers are so great that moms give up in the first place. It's not really worth it to them.
I gave birth to my daughter last year in May, and then after returning from maternity leave, I was happily surprised they had just opened the lactation room. I came back with very low anxieties, not having to be concerned of where I was going to find a place, how often I was going to be able to pump. In turn, that equated to being able to breastfeed for a whole year. It really takes a lot of the guesswork of coming back to work and being a breastfeeding mom.
So what's next is we have to empower our moms and our WIC moms to advocate for themselves and help transform the businesses they work at to be breastfeeding-friendly workplaces. We have toolkits that help their businesses easily implement policies, easily develop practices that support breastfeeding moms in the workplace. And we were able to do that through this grant through the National WIC Association.
Historically, healthcare providers have had little to no training in breastfeeding education and support. And the second piece of it is that they really need to know how to integrate breastfeeding practice into their current practices to be able to make it sustainable. So here at the Loudoun County Health Department, we created a toolkit for healthcare providers in our community to address some of these gaps that we had identified in both knowledge, attitude, practice, and actually practice management. So we've been able to distribute these to all of our healthcare providers who provide care for our babies in our community.
We know that mothers who breastfeed are going to have less lost time at work because their children are not going to be as sick. They're also going to have more satisfied employees. So there's a whole list that supports why a business should do this.
We have been working on the idea of spreading the word about breastfeeding awareness, as well as supporting not only our patients here at Loudoun Pediatric Associates, but also our employees who are nursing mothers.
We recognize the importance of ensuring that mum has an ability to provide the absolute best nourishment and nutrition to this little boy or little girl that's just joined us in the world. Being a healthcare provider, we're very, very sensitive to making sure that mum has an ability in terms of her shift and her flexibility. Private rooms, the ability for mum to express while she's here on the job and still continue working remains really, really important for us.
The partnership with the Loudoun County Health Department has meant a lot to the Loudoun County Chamber of Commerce, especially the ability to integrate the breastfeeding program into our Health and Wellness Challenge. That's always been about helping our members institute wellness programs for their employees to ensure their wellness, their productivity, and also as a retention tool for them too as well. So it's really provided an additional resource that has made the Healthy Business Challenge better than it's ever been before.
I think that becoming a breastfeeding-friendly workplace is something that pretty much every business should be able to do. It didn't cost us any money and it only makes it better for the staff and for people that are coming in to your place of business.
We think that this is just the start, really. Our 20 businesses and our county can be a model for other businesses in our community and statewide to be able to implement these very simple practices that we know can have such dramatic improvement of health for the children of our community.
Supporting WIC and supporting their breastfeeding initiatives is so important because this is the health of our women, the health of our children, and the health of our infants. The future of our nation literally relies on the health of our pediatric population. So if we can help infants get off to the right start with exclusive breastfeeding, then we are setting ourselves up for a successful and healthy future.